My name is Dr. Cornell Pearcy. I am the Northern Regional Medical Director for the Employer Solutions Group of Take Care Health Systems. In contrast to the Take Care clinics found in hundreds of Walgreens pharmacies around the country that you may be familiar with, the Employer Solutions Group has a 40-plus year history of providing care at employer-sponsored medical centers around the country in various clinical settings, including occupational health, primary care, acute episodic care, disease management, fitness, and pharmacy. So if you are a physician, nurse practitioner, or a physician assistant who is considering working at one of our worksite medical centers, I trust that you will experience the professional career rewards that I have experienced working for Take Care Health Systems for more than 22 years. Early in my career as an internal medicine physician, I worked in a large internal medicine practice where we saw 30 to 35 patients a day in the office, not counting telephone calls. We had to take call and see patients in the hospital. The practice also had operational responsibilities such as recruitment, payroll, and billing. We were also challenged with keeping up with the changes in reimbursement as well as the changes in the clinical practice of medicine. Although this was in a large group practice with about 10 medical providers, there was very little opportunity for collegial dialogue and discussion of clinical topics. We were like racehorses with blinders on, as we would see our patients then leave at the end of a long day. When I first came to Take Care Health Systems, I found a refreshing change from the grinding routine of private practice. As a physician and medical leader in various clinical settings throughout my career with Take Care, I found great satisfaction in being able to spend more time with my patients, and that additional time afforded me the opportunity to take a more holistic approach to their care, not just to treat their chief complaint, but also to now focus on preventive screenings, disease management, as well as the psychosocial aspects of their care. Although I worked at specific employer work sites, I found great comfort in knowing that I was a part of a clinical community that consisted of physicians, nurse practitioners, physician assistants, nurses, fitness specialists, and pharmacists that collaborated together to provide patients comprehensive primary and extended care in the workplace. With the challenge of keeping up to date in the practice of medicine, Take Care Health Systems supports our medical providers with two departments. First, our clinical education department, and second, our clinical performance management team devoted to providing evidence-based clinical resources. The resources from our clinical education department include Take Care University with its treasure chest of self-directed online courses in clinical education, leadership, and technology. Our clinical performance management team is dedicated to quality improvement initiatives, policy and procedure development, clinical guideline development, and keeping up with the regulatory changes. I was always challenged with arranging for patient education and extended health and wellness support for my patients with chronic diseases such as diabetes, asthma, and heart disease. At Take Care Health Systems, there is a population health team dedicated to providing such care via health coaches and disease management nurses. So, if you are a physician, nurse practitioner, or physician assistant seeking freedom from the clinical and operational challenges of managing a practice, or seeking opportunities to spend more time with your patients, or seeking the satisfaction of being a part of an engaging clinical community of diverse medical providers, then we invite you to become a member of the Take Care Health Systems family and experience the professional career rewards that I have experienced over the last 22 years. If you would like to hear more, contact a member of our talent acquisition team who would be happy to answer any questions that you may have about the exciting opportunities to work for the Employer Solutions Group of Take Care Health Systems.